February 2024 board workshop meeting to order. The time is 6 o'clock. Adrian, can you please call roll?
Ms. Barnes?
Present.
Ms. Borrego?
Present.
Ms. Mendoza, she called ahead to mention she won't be able to make it to this meeting. Mr. Rodriguez?
Present.
Mr. Cimental?
Here.
Mrs. Struck?
Present.
Ms. Zuniga?
Here.
Item number 2, workshop. 2A, budget workshop presentation by the administration team.
Good afternoon, Board President Rodriguez, board members, Dr. Hodges. Today we're going to bring you a budget update, and I'll go ahead and get started just to kind of recap how we got to where we are. So last year, we started building the fiscal year 24 budget, and there were several workshops that were held. There was one on March 28th, an additional one on May 23rd, and at this same workshop is where the compensation package was approved. There was an additional workshop on June 19th, which was actually going to be the adoption meeting. However, we were tasked with additional changes, and an additional meeting was held on June 26th, at which point we adopted the fiscal year 24 budget. During these meetings, there was information that was presented. In March, the initial meeting, we presented what we forecasted the budget to be, and we did forecast a little over $6 million in deficit. We did some work, and we came back to the board in May, and we presented an update on the budget. During this meeting, it was presented the different scenarios that were going to be evaluated after the budget workshop as far as the compensation plan. We presented the effects of no raises, 3 and a 4% raise, and a 3 and a 5% raise with the effect on the deficit. This was prior to the 1.2 additional positions, the $1.2 million worth of positions that were approved after the compensation package was approved at the same workshop. We also presented the effects on fund balance during this workshop, and the different scenarios and the different effects that the raises and how it would impact our fund balance. On June 19th, we came to you with a budget, and it was a little short of $6 million on the deficit side. And at that time, we were tasked to meet you in the middle, is how it was put, to bring that down to $3 million. So we went back to the drawing board, at which point, on June 26th, we presented a deficit of $3.7 million. The board elected to adopt a budget of exactly $3 million. 700 of that deficit was not allocated. In other words, we were going to have to do additional work during the year to find that $700,000. And so on June 26th, a deficit budget of $3 million was adopted. Since that time, there's been several budget amendments that have added to the deficit. One that has been noted and has been brought up and requested additional information was the historical transactions for the maintenance tax notes. These, here we indicate what we received in the proceeds, which was $10 million. We also received 2 grants and a rebate from El Paso Electric. The total amount that we had available from the maintenance tax notes was $11.2 million. Of course, we spent about $8.4 million of that in technology and also an LED project. And also we've spent it on paying back those maintenance tax notes. And we also had $627 taken from a signed fund balance and was board approved in August. Our current balances, these are as of February 15th. We're about to make our next payment, which is due on the 15th. And these will be our current balance. We have a principal and interest balance of about a little over $8 million on these maintenance tax notes. We have 7 additional payments to make. So that brings us to our current situation where we're at now. Of the deficit, Dr. Galaviz has been tasked to find the $3.3 million deficit. We are adding a few items to these numbers. Sometimes when I present these information, I tell you to keep these items in mind. However, we've been tasked to make sure that we present them clearly, so now that's why they're incorporated here. One of them that is new is the estimated state funding loss. We ran our new templates and our new numbers. We received the Texas Comptroller values on January 31st. We plug those numbers in, and our state funding loss we estimate to be about $2.5 million.
Can you elaborate on the templates and
Right.
how it's always, numbers always moving the projections?
Correct. So we receive a template. So this is what we call the Omar template. I don't know if anybody has ever heard of Mr. Omar Garcia. He is the state funding guru, and every district in Texas uses his template to predict and estimate funding from the state, from TA. He helps to interpret law, how it will be applied, and he makes assumptions of how the law as it's being disseminated is going to be applied and how it will affect Texas school districts. So we start with a template that he provides usually in May or June, and we add information as it becomes available. Of course, we don't know our enrollment, so we estimate once that information becomes available. We update our templates. Just like this last template that we received, he entered our preliminary values that were released on January 31st. So with that and as well as our updated ADA, the net effect on our funding was $2.5 million deficit. This is about my 7th run on this template, and depending on the information as it becomes available, that could also change. This year has been particularly difficult to estimate. I usually have my own analytical ways of estimating, looking at trends, how much we normally increase, talking to CAD, what they're doing. So when I apply these different scenarios, I come pretty close to what our funding is. This year was a little difficult because of the $100,000 homestead exemption. And so this is our first time. That's a huge increase. Plus they also did some adjustments to the freeze, to the tax freeze. So it's been difficult to predict those numbers. So we had to wait for the preliminary values. Our funding is not based on preliminary. It'll be based on final. Final numbers will not be available until August, which means our school year is already over before we even know what our revenues are.
You mentioned some, you're discussing about you're supposed to be held harmless.
Hold harmless, correct. So we have a provision that because the exemption was raised to $100,000, the districts will be held harmless. In other words, the revenue that they're losing on tax collections, the state would make up and hold us harmless. They basically would true us up and we wouldn't lose anything. However, because our ADA, is so low from where we adopted, the difference, so in other words, we lost kids plus the percentage is lower. We adopted at 97%, and now I'm estimating at about 94%. We've been trickling at the low 95, but usually we do decline in the second semester. So I did estimate at 94%. That translated to about 250 in lost ADA.
I have a question, because this is not the first time ADA has come up. What are we doing as an administration with the schools? What's being done at campuses to increase that? That's low. 94%, even in the spring with flu, with everything, 94 is low.
So I can speak on the data side, Ms. Borrego, and two members of the board as well. We are providing data daily to campuses so that they can identify each kid that is out that day. We're able to provide them with, are they excused or not excused? We're able to provide specifics on the data for those kids. On the campuses themselves, we're educators, so we remember the pizza parties, we remember the incentivizing attendance. So when COVID hit, we incentivized not coming to school because we didn't want kids sick, right? We said, hey, if you're sick, stay at home. So now to reverse that trend is when we start feeling it. So now we're trying to target when it comes with data of telling campuses, for example, on any given day, your 12th graders were out. We had an issue, just as an example, where a lot of the 11th graders were out. So then the administration reaches out to those campuses to see what's going on. That was an ASVAB testing day, which created those numbers. But that's just to illustrate what we do on our end to make sure that we are keeping track and informing principals about those rates.
And I get that, that's great, but then what are the principals doing with that information? Are we calling parents? Are we meeting with parents? Are we having meetings, especially with the repeat offenders with that?
So, my department is charged with helping the principals and the campuses facilitate truancy and attendance rates. Right now we are doing a traveling show, so we have already met with 2 campuses, and the others are coming this week and next week. We are putting together data information based on what Dr. Rico's talking about and what they have, so that we can monitor how many truancy action plans they put together, how many they're referring to court, how many are court cases, because the word of mouth, when you have and hold either students or the parents accountable and they're going to court, people are hearing about it. That's one. So we're really trying to facilitate and make sure that that's happening. The second one is that when we talk about attendance rates, we're also talking about loss of credit and seat time. And that's across the board. That's not just high school. We are really pushing this out for all campuses to practice so that parents are being trained and informed so that when we move to middle school and high school, they already know what is expected here in Canotillo. So at these little traveling shows that Ms. Villarreal, Mr. Juarez, and myself are doing with the principal, the assistant principal, the attendance clerk, and we are talking about specific cases. So we're helping to facilitate and address that. That is happening as a mid-year report, and then of course it will branch to the end of the year so that we can talk to them again and talk about during the summer, what are you going to do for next year to ensure that you're giving that information. So we are talking about this. We are talking about this more often. We are out there, and Mr. Juarez is working with campuses. We are also doing parenting classes. So we've got lots of strategies. We have a truancy behavior improvement plan that they put them on as well. We've monitored the reports with absences, whether it's excused or unexcused. So, I mean, we're out there trying to push the message. The thing about it is that we're also, oh, and I need to mention this, our guidance review team is coming together next Thursday, which includes principals, so that we can create regulation. So we can push out more in a standard operating procedure to assist with attendance and truancy. So I hope that helps a little bit more, but we really are being active.
Do we know, Ms. Borrego, of course it's terrible, it's so low, right? But do we know why it's so low?
So the first 9 weeks, is super high. The second 9 weeks, we see a drop.
And
We've
it's
had a
just-
drop from 1 percentage point to a campus that's had 4 percentage point drop. A lot of it has to do with illness. We're seeing a spike in COVID, we're seeing a spike in the flu, so that is one of the things. We do have a couple of campuses that have expressed that parents utilize the intercession and the break, and they take extra days because they plan a cruise or a trip. That was a discussion we had with the campus yesterday, so we're putting together a plan for them, because for whatever reason, parents feel, well, I'm making these plans. Correct. So we're trying to get the word out there about this. And what can happen is, regardless of whether it's excused or unexcused, and the principals are unexcusing some of those trips, seat time can be made up. So kids will have to come during intercession or on Saturdays or after school or summer school to make up the time, and that includes elementary. Because
But
the
that
law
doesn't give us
says
our
90%.
Yeah.
ADA back, it doesn't give us
Well,
our
it
ADA.
doesn't, but we have to start somewhere with a message to say we are really being diligent about this, we're really monitoring, and we're really pushing this communication out to parents, so that they understand that the instructional time that their child is losing, as well as the fact that they're not meeting the law with the 90% or with the House Bill 2398 on truancy.
And I applaud all those things, they're all great things.
Yeah.
My specific question is that, is a phone call being made that
Yes,
day
ma'am.
with those relationships?
Yes,
Whether
ma'am.
a teacher or the principal saying, hey, I missed Lucy, little Lucy, she didn't look sick yesterday, where is she?
Yes, ma'am. That is also
Because that
happening
puts
as we're
pressure on
talking to
parents.
as we're talking to campuses, specifically about this, and I forgot to also tell you that the attendance review committees are pulling parents in and saying, why are we absent? What's going on? We need to peel that onion and find out what is happening in the home that child is not there.
And it is happening, I can attest to that. My granddaughter, I know they call her. She's out, so they call, they want to know what's going on, right?
I have an understanding that if they're absent, if they have the flu, that they can take online classes, right? They work, well, until what, Tuesday? Do we know why that was taken away?
So I think that's a question for me. One of the things that we're strategically doing as well, the state will allow us to take a certain amount of days per campus that we designate as low attendance days. For example, we had a couple of days at the high school where attendance dropped about 80%. So we worked strategically with Dr. Kearney's office to figure out at the end of the year, we're gonna identify those days that we can exempt. So basically what we tell the state is, please don't count this day in our percentages. And then it returns back to our ADA. So going back to what Ms. Borrego was saying. Additionally, we were able to use remote courses before for ADA credit. The state changed the rule right in the beginning.
I'm like, I hope they're not doing that because we can't.
Right, so they changed the rule right in the beginning and did not communicate it until their roadshow, they call it. We utilized something called an student attendance handbook. And so in the student attendance handbook that we had available all the way up to October, we had an opportunity to do that. What we were trying to petition from the state is, hey, you changed the rules. Sorry, you changed the rules in October. We want to apply for a retroactive waiver for October. It'll be an uphill battle, but it's one that we do want to fight. Another thing that we have seen is what I was trying to take on an approach that you're familiar with a company called Good Day. And we worked on something like that, of having those telehealth services available at schools. To try and combat the fact that if you're sick, just don't stay home, right? There might be access to free healthcare through a teledoc in the nurse's office actually. And to also illustrate for the board, if a child shows up sick, does a telehealth appointment, and remains at the campus for a certain period of time and certain intervals, we can count them as present. One of the biggest drawbacks we have is, and we all did this when we were kids, right? When you're sick, you stay home a couple of days, and unless there's something major, you don't really attend a physician, which we cannot then collect ADA. So our hope is that we provide that medical help and in that setting, that we'll be able to combat that as well.
Sure. I did want to attest to that, Ms. Borrego, that we do call every single student that is absent, There's, in Teams, it picks it up, and so it makes a robot call to everybody. In addition, a lot of our campuses, what we do is we have a registrar or the attendance clerk call every single parent to verify. Because at the end of the day, it might be too late. But if we can get a parent in the morning and say, your child is not here, is he sick, is he not sick? Oh yes, we're taking them to the doctor, but we're gonna take them back. Or is he really sick? Please bring a note. Of course, a note doesn't justify it. It doesn't give us the ADA, but at least we're able to make that contact with the parent. So our attendance clerk, and I know the attendance clerks at the other campuses do the same. We do home visits. I do home visits with my attendance clerk, and we go door to door. At one point, we went to 3 different homes to just look for one student that was staying with their grandmother, but we went to one house, another house, and another house. And just to make sure that they really are sick, especially if they're repeat offenders, we want to make sure that parents know that we're out there and we're looking for them. It's not going to be okay. So we are doing everything we can, and unfortunately, we have a lot of kids right now that are sick with the flu.
My question was, of course, this is kind of I'm worried about when the kids start to new school, but what I'm worried is, well, they don't get behind. Do they assign, for example, do they have to show homework? Let's say if a kid is going to be 5 days at home, they need to be updated on homework and assignments and everything, so they don't get behind?
That's a great question. That actually came up in our conversation yesterday with a specific campus. And so next Thursday, that is what part of our regulation will be, is how much notification does a teacher need so that we can make it standard operations? How much time do they need so they can either get the work beforehand or after? How much time are we allowing students? And then how are we going to be addressing the support to that student if they are out for multiple days to make up the work on top of trying to do the work that they're there for on the day that they're back. So those are conversations we're going to have next Thursday at our guidance review team. And we're bringing principals in so that they can give us the feedback so we can create that regulation.
Thank you so much.
I have a question in regard to time for attendance. So I know there's a specific time that every campus takes attendance. Is that correct? What time is it for? Is it 10?
So it varies for elementary and middle school, high school. We are being very diligent as far, it is around the 9:30, 10 o'clock, 10:10.
Yeah, and it's by period at the high school.
And so we are trying to make sure that teachers are very succinct in putting in that time prior to the end of the day or the end of the class period. So we open up the Teams window for them to be able to put the absences in or the information for attendance within a short amount of time. So that way teachers are specifically saying, okay, I know I need to do this right away, because we got to get that information in so that our attendance clerks can start making those phone calls.
Are we doing anything at the campuses to remind about taking attendance? Because I can tell you as a teacher, I was the one that the registrar would always call and be like, Ms. Barnes, you haven't taken attendance. So, not that they need to do that, but for our teachers, like, I have 3 alarms on my phone for attendance. If I accidentally ignored that first one, then you know what I mean? But are we setting them up for success and reminding them these are things that you can do, we are doing this, but then also making sure that parents know if you're gonna have appointments, schedule it after 10 o'clock. That way your child is counted present, they still can get their work for the day, so on. So are we communicating that?
Yes, we are. Good evening. So that's one area that we've been a lot more intentional about, because I think we got dinged on an audit or something that I think there was a teacher or something found not to be taking attendance at the appropriate time. So all of the campuses have instilled practices to ensure everybody's taking attendance as they should at the appropriate time. I also wanted to say that with our principals, Ms. Borrego, we have met with them. We are holding them accountable. We're having data meetings with them. We've had them already. And we've asked them to share, what are the practices that you're doing? What are the strategies, that are making a difference, not making a difference? I had one principal that's done like 200 home visits. I mean, they are trying. They are working hard. So we're just doing the best we can. We want it to get better, but the remote conferencing is something that we, are turning around as far as, maybe we're still providing that support, even though we can't count it with the state as far as, unless we get the approved waiver. But as to answer Ms. Trout's question, that's one way we can continue to provide support for students that are out for several days with the flu, but we may or may not get funded. We're still working on, whether or not we could recoup that kind of funding.
Plus also there's a House bill, that we have to accelerate instruction for those kids that are behind. You have to provide accelerated instruction for them and make sure that, you're providing that, so that's kind of the safety net so that they don't get behind.
They don't get behind. Thanks.
Any other questions?
So Ms. Foley, you were talking about the health harm list, so, we wouldn't have usually been as affected by that, but because we set our budget at the 97%, rate, and we have only really met the 94 to 95, we had, did you say $250,000 loss there?
No, so it translated to 250 lost in ADA as a number. But in total as dollars, the ADA that we lost is $1.5 million. However, because enrollment is low, we've also lost, and not only low, but also our demographics are changing. So our SCE funding, we lost about $500,000 in SCE funding, and then we also lost about $250,000 in CTE funding. So those items combined is where our net effect is about 2.5 from where we were when we adopted the budget.
And can you explain the SCE funding and why we lost the CTE funding?
CTE is based on enrollment, so depending students taking certain courses, we get funded. As far as SCE, there's 5 tiers for funding. So these are our at-risk students, depending on their economically, their tier, where they live, basically, determines how much funding we get. 1 being the lowest and tier 5 being the highest, and we've had a shift in where our students are falling in those tiers.
And if I may add on enrollment, the biggest cohorts that we have currently are 10th and 11th graders. So as they transition through the high school years, Ms. Barnes, that funding will change because the replacement class is not as large. I know Ms. Foley's been talking about the enrollment loss, right, and the ADA loss. We were forecasting to take a hit as we have been taking to the bond committee, right? We were telling them we're at 19 million in several years, we're going to get to 30 million. This just precipitated in a way that we were not anticipating. We were not anticipating the non-replacement of students that we were graduating out. We knew that this was going to happen. We just didn't think that it was going to accelerate as much as it did from the prior year. So we took a hit on that one here, along with the homestead extension. So I have figures here that we discussed earlier. There was $7 million in taxation, but the district only regained 5 because of the loss of enrollment. So we tried to forecast as much as we could with patterns that we had before. I know the number we gave to you guys was we were losing about 140 kids, I believe. I got to look at the notes, per year due to transfer and attrition. But that number this year went up more than expected.
So going back to the estimated state funding loss, I think the issue here is we know that the average was 94. That was a historical, right? Over the years.
We had
Yeah, I can answer that one. Historically, as a district, so the Winnebago by campus is 96. Now, historical, we removed, Rodriguez, we removed the years that COVID directly affected. And we didn't have an impact in funding because we had that health harmless at that attendance percentage. So this is the first year in a traditional year that we don't see it hovering around 95, high 95 and low 96.
So you're saying previously, because what it's saying here under previous presentations was that we were showing a 93.91. This was May 5th of 2023.
Which presentation?
Pretty much all in one say. The May 5th was I guess the end snapshot was at 93.91.
For the year?
Yeah, yes.
And the original projections were 94, and you updated the projections to 96. So what was the previous year's anticipated projection?
I don't have that information. I know that we presented it, it's part, actually, I think maybe part of your slide.
Yeah, and you know, Mr. Rodriguez, I think one of the things, and we thank you all for your efforts, right? You've always done what's best for the community and for our staff. You were tasked with something very difficult, which was in a moment of chaos, to go with your heart and provide those incentives for teachers, raises for teachers. So we know the situation that we were looking at. So, Mr. Rodriguez, when we looked at last year's attendance, where it was hovering around 94, we figured that we could come up with strategies to bring up that attendance, because we saw it get progressively better from the time that the COVID was impacting our attendance to now, and aggressively anticipated that we would be able to make up for that loss and go back to our pre-COVID rates, which is why the projection was adjusted. But, you know, at a time when we were looking at those budgets, we wanted to remain transparent and be able to provide you with those strategies. They just haven't yielded the results.
What were the before COVID numbers?
For attendance, we have always historically been around 95.5 to about 96.2, depending on the years and time frames that we look at. But historically, we could say around 96, which is low for a district our size.
And I guess dealing with budget projections, my thought process is after the numbers came in, we hiked that number up to 97, and yet we still had the 3% that was previously projected. There's still that gap, and that's where part of that state funding projections come from, right?
Correct.
And so that 3%, because we should have just utilized the previous year's projection, but you went from 94 to 97. So that 3% comes out to a total of how much?
250.88. As far as like the translated number, or it's 1.5.
1.5 million. And so the other is, you said 250 from Korean technology?
250, and then there's 500 from SCD, and then there's some other small numbers in between. Those were the larger amounts.
Okay, continue.
And on that note, just if I may add something, Mr. Rodriguez, we also had seen in previous years that when numbers were drastically different, like 93 to 96. I know it doesn't sound like a lot when we think of our math test in high school, right, at 3 points. But when you're looking at the translation in the millions of dollars, that it hurts kids directly. So through efforts of school boards like yourselves throughout the state, the advocacy that you guys were doing throughout your means, Mr. Rodriguez, you're the president of your the organization, you're president of TASB. You know, those advocacy efforts to really bring that back down to grassroots levels and where it was affecting schools. You know, we were able to see some of those hold harmless provisions for school districts across the state as they were being impacted by this. And we thank you for the fight and everything that you've done to advocate on our behalf, but sadly this year that was not an option, so we were able to take this hit as well.
The question I have, the board adopted deficit budget of 3 million. Where's the 385 from?
The 3385, that's where we were at our last presentation, where we showed you the salaries, the savings that we project from adopted to actual results, less the maintenance tax note payment.
You mean this presentation?
The one from, I think it's a blue one.
16?
January 16th. Yes, I believe so.
So you went 3 million, and where's the 385 from?
It is, it's a 3385 plus the maintenance tax note payment. And you'll see it in, there was a column where it said, projected results or actual for fiscal year 24. And it was 4.4 or so, 4.5. Okay, I believe it's the blue presentation.
What's this one? But you're
And
talking
there's one
about
that says
the
budget.
the changes of assumption?
Yes, on the next page, I have it here.
The 518?
It was on page 7 of the one from January 16th. So that 4538, that's under projected actual, less the maintenance tax note payments, gives you the 3.38. See that?
So I see the 4.5 under projected actual,
Uh-huh.
and then what was the second?
And then, less the maintenance tax note payment of 1.152
Right.
gives you 3.385.
Makes the difference. Yeah, so we need to make the math.
3.3.
Gonna give us the difference.
Okay. And
The
that's
thing
exactly
is,
the number we're starting with on
The
this.
last board, when we adopted, the board adopted the $3 million deficit. Now is the difference amount. My concern is, what are we gonna do with this deficit? What are we gonna do with it next year?
So we did start with a $3 million deficit. However, we have brought forth several budget amendments that the board approved. They're listed on that same presentation on page 7. These amendments were all board approved. The playground resurfacing, these are items that have come up that needed funding and were approved to be funded from fund balance. Right. So this has, of course, added to the original $3 million deficit.
And if I may add to, as well, Ms. Trout, so the deficit is not gonna go away if we cut from the 15% operational that we have, right? So when you look at the biggest expense, and not just for the district that you guys preside over, but for districts across the state, it's personnel. So when it comes to looking at decisions regarding the void that we're seeing, and I wanna thank you for your support with the bond efforts, but we're not gonna get those results until those schools are built, right, of attracting enrollment. We're not gonna get the results that we anticipate within this year or next year. So therefore, as a district, our strategy has to be to gain back some of that, of what you're seeing here through different strategies that can bring back real numbers in recurring costs and not just cutting costs for 1 year, right? I know, for example, on my department, we can hold back from buying something this year, but that's not going to really create savings that you as a board are going to need to see in order to have a healthy funds balance. So with part of our strategies, we will be coming to you with different suggestions for you to adopt. And they're difficult decisions that we have to make. But it's decisions that as we right size for our current reality, must be made.
So this is,
I want to go back to the changes and assumptions and go over each one of them. You're saying the playground resurfacing, because we've had this conversation before. When did that actually happen?
I actually have it down. So this one was board approved at the June, the RFP was board approved to be paid out of fund balance in June.
Out of June?
At the June board meeting, it was.
Before we adopted the budget?
Yes, it was a board item. It was part of the consent agenda.
No, I understand that, but what I'm saying is that this was approved in June before we adopted this budget. And you're utilizing this as a increase to the deficit which I disagree.
Right, but it was when we put a funding source, because we did not have a funding source for this. So when it was presented.
But you knew we were gonna make that purchase in June.
Yes, we put an RFP out. We did not
And we
have an
approved it in June.
identified.
You said we approved it in June.
Yes,
So how can we approve something in June, adopt a budget in, when was it?
June 26th. It was adopted. It was, they were both approved at
So
the same
it
board.
just wasn't put in there.
Right, because the agenda item, the executive summary provided a funding source. The funding source, we did not have an identified funding source. It was $400,000. We asked the board if we could use fund balance, and the board adopted it and said yes.
Yeah, they were on the same.
And you said it was on consent agenda? So I think because we're in a deficit, I would like to propose something that maybe you come back with us, administration. Is there anything from now on, an RFP, whatever, that's gonna put us more? Because I think in consent agenda, it's just, oh, quick, because I know how it works. I've been doing this a long time. Consent agenda, and then we don't know what's happening, or it's so fast, or we don't really understand the whole thing, and we can't ask those questions. So I'd like to propose that, starting now, that anything that's gonna increase our fund, our deficit, that it not be on consent agenda, that it be up for discussion.
If I can add to that, and with all due respect, Lucy, I agree with you, but I think that's part of the homework we have to do beforehand. Those questions should be turned in beforehand. Those questions should be asked beforehand. That's our job. And so we need to make sure we're doing that, but I agree that I think that for now, because of the situation that we are in, we should probably pull them from.
And I get it, because I go over them, but the thing is, we don't have discussion. I don't have anybody in front of me to ask. And sometimes, well, and,
We're supposed to email.
yeah, but I think, and I get that, I just think that sometimes it gets lost.
Exactly, I totally agree with you, Ms. Lucy. So definitely those things, maybe we could spot it, maybe not, maybe we get confused. And we have the new board members as well, maybe they don't have that ability and they would like to understand better, because every vote counts. And it's our responsibility, like you said at the previous board meeting, it is our responsibility the way that we vote. So we need to understand perfectly what are we voting for. In those little things is because, of course, you guys have all the experience, yeah, go everything consent agenda, but these kinds of amounts, we need to see it, we need to process, and we need to see if we
And discuss it as a team.
Definitely, we need to discuss as a team, here's the whole board, because definitely it affects right now what we're gonna do.
Because if I ask, let's say I ask Dr. Galvez, well, he's gonna give me the standard answer, which is fine, and it's the right answer,
But you'll keep the answer for you, and
Yeah,
the rest of
and
the board, they give
correct.
the best.
And sometimes they share it, but I just think at the end of it, if something's gonna be part of the deficit, that it not go on consent anymore, that it be part of the
I
board.
agree, and we can definitely flag it.
Because
for
look at us
attention.
all here,
Yes.
we were all here, but we're saying, we approved that for the playground?
Yes, we can flag,
Okay.
items that could negatively affect.
And remember, there's rules in the consent agenda, you cannot pull it.
Yeah.
If you have to make a previous question, but then the answer is gonna be only to you. And what about the rest of us that we can
Answers are
affect?
shared to the board before the board meeting.
But this is a good way to fix that problem,
Yes,
is that
absolutely.
no
We
more
can do that.
consent if it's gonna add to the deficit of the budget.
Totally agree.
Well, I know we voted it in June, and I remember, some of the issues because of the safety issues. The issue that I have is if we knew it in June, we should have put it in the budget. And so, now I go to the next item, the CTE building. When was that approved?
This has been an ongoing project, and they needed additional funding. We also are required to spend 55% of the CTE allotment, and they have been short on their spending.
So then why
Under
is it
budget.
coming out of our budget, out of our budget if it's paid for by the federal funds?
It's not federal, it's our
It's
local
199,
CTE.
isn't it?
Yes, it's our local
So
CTE,
199 local.
allotment.
So we didn't have that, it wasn't budgeted, you're saying?
No, so this was an additional amount that they needed to complete the project. And so we agreed that their funding with what was allocated to them was still short because we were waiting to see what salary increases, what impact that would have on their allotment, because we can't estimate, of course, until we know what that number is. So we don't want to overfund them, but we can't shortchange them either. So we need to wait until we have numbers. They needed to complete this project. They're trying to complete this project and they're still short on their funding. So yes, we did take some money from fund balance to allocate to them. And if we are short on funding, which we were, we are required to reserve that shortage in our fund balance at the end of each school year.
So this wasn't required regardless.
Right, so they were budgeted for it, they just didn't spend it all. And because the transition time on the CAPS building it's taken longer than what was expected.
And so then I go to this maintenance tax notes, which we've had this discussion about, and I've had it with Dr. Galleries and staff. I disagree that this is a separate, in regards to the budget deficit. It was in every presentation dating back till March, and now we've included it. And the reasoning was because there was a loan amount, which it wasn't fully a loan amount. Can you go over that?
Sure, so you have a slide with the historical amounts. So we've paid, the first two payments we paid from the remaining proceeds plus reimbursements.
They're on the current one.
And also you said that still 7 additional payments that we need to make this week?
Correct, it's a 10-year loan.
10-year loan?
Yes, so we completed 3 payments.
Can you help me to understand the amounts, and can you please tell us how much was the payments and how much was the owing in these tax notes?
Yes, so on this slide here, we have made 3 payments towards the $10 million of about $1.2 million each or so.
Okay.
And that includes principal plus interest. So every year we pay interest on the remaining balance. Currently, once we make our payment, which was scheduled to go out on Monday, our balance for just principal is about $7.3 million. However, if we pay the loan in its as it's amortized over the next 7 years, we will have, our balance is $8,075,000.
And I disagree that I understand where you took some of the loan money that was still needed and it could only be utilized, but that 627, if anything, should not be under changes in assumption. It should be part of the original budget. The next is insurance increase, and of course, I mean, looking at rates, but I do have questions on this, and if you could explain that.
So those are rates, we don't receive rates, I believe, until, I don't know if Mr. Barra says here, usually around August. Our renewal period is in September, so we don't have what our new rates are going to be.
So in September, we renewed and we had a new policy.
Correct. So our policy, I believe, runs from September 1st through August 31st.
So the increase just was this year?
Correct.
And is that prorated, or is that just policy amount that was increased?
That's the policy increase. That was the charge.
So do we pay it monthly, or
we pay it annually once a year?
So that was just an increase in that.
Correct.
And then,
Mr. Rodriguez, if I may add on that one, it was an unexpected increase, and so we started looking at strategies that other districts are doing to accommodate for such a rise in premiums. That's when we got the CISD bulletin that talked about the advocacy points and property insurance being one of them. So we started to see with member districts and seeing, okay, so what are you guys doing? What is happening throughout the state is now you're starting to break off certain things that you might not need, might need, right? So just to illustrate it, not that this is our situation, but if cybersecurity insurance gets too expensive, you just remove it and kind of, like as you would at home, right? You decide I'm going to remove this premium and hope that nothing happens. So the reality of what we understand throughout the state is what they're calling a piecemeal, right? Of piecemealing different policies together and getting just what we think is most crucial in the infrastructure insured. But thankfully, again, CISD under your leadership as well is showing that as a priority for this year as well.
And I guess the question I have, and I go back to the deficit and that 3,385,000. Would we subtract that 627? That's
Added back to the 3.3. Is that what you're saying?
yeah.
Yes.
In other words, to get to the 3.3, I mean the 3 million. I could see where the playground and the K, the insurance, but those are some of the issues that I have. And then when we go back to, because it was actually a larger deficit, we looked at the land sales, but the board has not made that approval yet, right?
For on this.
To see where the land sales will be going.
Right, so we were asked to include that in there. That would be our net proceeds. It may be a little bit slightly less based on closing costs. I believe our net proceeds would be about 1.58, but I don't know what the closing cost would be. So if that land sale goes through, then yes, that would be added revenue.
And we could designate that there, or we could designate it into the healthcare fund balance, right?
Right, I mean, we could just basically just leave it alone and let it add to help us to recover on our deficit.
Okay, and I guess is there any other questions on the budget deficit?
So that is projected, we're assuming it's going to be around the 1.5
Correct.
revenue, and then that's for the land sale for which piece of land?
Cat Carter, that's the, I don't know, that's the official, that's what I go by.
That's near BC, is that correct?
Yeah.
Right. Thank you.
Our health insurance, you said it goes from September 1?
No, that's property, commercial.
Or what's our health
liability
insurance?
Our health insurance, our policy runs from January 1st through December.
Okay, so
Our year.
we have time now. We don't have to do it today, and I don't want a big spiel, and I don't want to hear on and on and on. I think that we have a very lucrative health plan that is for rich school districts, and there isn't any right now, hardly in Texas. I think that we need, and we have the time, because I think last time, if I remember correctly, we didn't have time and we can't make this change right away, so we were kind of forced.
That would probably be on the next.
Yeah, and I would like to do like a budget workshop where we just do that and you bring in TRS, because I wanna hear them for myself and I wanna ask questions.
Thank you. And Ms. Moreno, also just to note and for members of the board, you see the healthcare fund infusion, and I know before a number of $2 to $3 million was forecasted. So that is now at 1.8, and this was because of the enrollment behavior and the savings in some of those claims as well. So this is a forecasted number at current behavior, but again, depending on the health of our employees and on the savings that we're forecasting, this can change as well. Originally, we were thinking anywhere from 2 to 3 million, so this was a pleasant surprise with all the other bad surprises that we got.
That was gonna be my follow-up question. So at the last meeting, we had said that the last estimate we had got was around 3 million, so it actually came in less than that.
Correct. And just to expand a little bit more on that, currently we ended the plan year at a deficit of.
It's number one.
I'm sorry?
If it's number wise, well, yeah, that's fine.
Okay. So it's projected that our plan year will be at a deficit of 840. So the board would have the option whether to, we would need to at least cover the deficit, but that also includes a reserve. The reserve is there to cover in case claims exceeds premiums, or we can do it as we go along. So that $1 million, we could possibly, and I'm sure Ms. Carrasco will expand on that a little bit in her presentation, but just to keep that in mind, we're just putting the whole amount there so that it's a visual for you.
And how much is in the healthcare reserve?
It's the target reserve should be $1 million. We don't have that currently.
We don't have that. Okay, thank you.
You can go over that a little more, maybe, right, just a little bit.
So, on your next, to move forward, we projected the fiscal year 25, projections, and we are anticipating, if nothing changes, we roll forward our salaries, I did re-estimate our revenues, and with our enrollment that I'm projecting for fiscal year 25, and we project to have a $7.6 million deficit.
Oh my.
This is absolutely, it's dire. It is not sustainable. We would not have the cash to operate, and it's quite dire. The next slide gives you the projections for fund balance. We estimate to be at about 44 days when we end this fiscal year.
I thought you said we were at 70.
At the end of fiscal year 2023, we're at 70. But now we're incorporating a $7 million deficit. So we should be at about $17 million to be at optimum. We are going to be down
And
to
that's 90. Are you saying optimum 90 or 60?
Optimum is 90.
The 90? So we need to be at 17.
Correct. By policy, we should be at 60. Optimum for financial stability should be 90.
And what, do you know the amount if it was 60?
I'm sorry?
We have 60. Do you know what the amount would be for 60 days? For policy, right?
It's about,
policy 60?
yeah, it's about 200,000 a day times 60. 12 million? 12 million.
This is not sustainable.
Right, we would not be able to operate, we would not have the cash flow for payroll, possibly in August and September. We don't receive revenues for the year. A lot of our bulk of our cash comes in around December and January from taxes. Of course, we don't spend it all at the same time, but just for cash flow purposes, we would not be able to sustain this.
So right now, what is our actual deficit right now?
I don't know what our actual deficit, I can only forecast, so I can, estimate what our salaries are, what our budget, what we have budgeted, what we spent so far, and with that incorporated, and this includes other uses also. We would lose about $7 million this year, if we leave the budget as is, and don't make any changes, as far as expenditures, meaning we wouldn't cut any recurring costs. We would be facing the same dilemma in the following year. And that, of course, it's simply just not sustainable.
The question I have is on the presentation that was provided us on January 23rd, the deficit, the budget deficit was projected at 2.897, and now you're saying it's at 7,654.
Yes, so we have those additional items that were added.
Which was
2.5 state funding,
and the healthcare infusion fund,
healthcare infusion.
which I've seen it since March of 2023. We said that we were going to set aside as a budget priority 2.3 million.
Correct.
And it stayed at 2.3 till we infused from fund balance at 1 million, and then we have a 1.8.
Correct. So this is, like.
And that's another item that we didn't budget, you're saying?
We don't budget. So in other words, the healthcare fund is its own fund. It's a self-sustaining fund. If it runs into the deficit, then it's a transfer from the general fund that helps to sustain it.
But shouldn't we project the amount of deficit that we're gonna have to pay with?
It's not a budgeted item.
It's never been?
No, it's never been. So in other words, what happens is that we charge premiums to the employee for their portion, and then the employer, us, we contribute $623 per employee into this fund. So from this fund specifically, it pays out any claims as well as administrative costs for the administration of our health plan. So it's a self-sustaining fund.
How did we get the 1 million then?
because it ran into a deficit. So there was not enough cash to pay the claims in the last year.
So we don't even know what the end of the year is for this year?
Yes, so we ended the year at 440, if I'm not mistaken, negative. And that's after the $1 million infusion.
And the previous year was?
440 positive. That was our ending fund balance, which you call your reserve. And it's part of the healthcare presentation. Our financials are in there, and you'll see those numbers. But of course, the numbers that we give you are estimates. They're based on forecasting. It's a crystal ball. You know, we're trying to project where we're going to be in 6 months. We don't know what happens in 6 months, you know, especially in the healthcare. You know, we could have high claimants. There's different scenarios that could happen. And these are based on the best information that we have available at the current time. Always subject to change. So that was my last slide as far as fund balance. Are there any other questions as far as where we are and where we are expected to be?
Well, I think where we need to be is the other question, and I think that's a serious conversation we have to have as a board. And what I'm thinking is we originally were at a $3 million. That's what we had agreed upon. The $395 for the playground, which was an unforeseen cost. It should have been, because it was in June, should have been in the budget. Then we had $50,000 for the skate building project. Is there any more increase on that?
They are in talking to, or I received an email from Ms. Andrews that they do need additional funding. However, we will take a look at what it is within her budget, if she can have it there, she can use it. So we can repurpose some of the current budget that she has.
So, then we had the insurance.
Fallsworth is a training that, it's the principal pipeline that was approved by the board last year for us to go.
Members of the board, we again thank you for your leadership. This is something that we wanted to.
I'm not done. So we're at 3471532. No. And then the 170. I think one of the discussions, but I'll continue with the presentation so that way we're gonna have to look at within this fiscal year to make sure we, I don't know what's your all's thought in having the administration look at extra amount to actually address, because I don't think this isn't sustainable and that needs to be looked at. So I need direction from the board to give direction to administration. What number should we look at for them to come back to us with other areas that we need to address?
Well, I did ask for information about central office positions and what those salaries are, not any names, but just those positions and salaries, and was told that that wasn't for tonight's meeting, so
I think that part's an input, I think we already have them out. The question is,
who has the amount? I don't do that.
we have, it's gonna give it to us, we all have the amount of money.
The breakdown for administration positions,
We have the total amount,
okay, but that doesn't help us figure out how much each position
that's
is
the
taking.
input, and on start governance.
Okay,
I think what we need to focus on, they were able to shave off a certain amount, we need to ask them how much more do they need to shave off.
okay.
That's what I'm asking, direction from the board, to see how much more we have to direct Dr. Galavis to shave off this year, and then address a balanced budget next year, with the conversation that we've had in the past at the January 23rd meeting was, and I understand there's, we're looking at this, but we've talked about how do we look at doing a balanced budget, and then how do we look at, balanced budget with maintenance cost if the bond doesn't fail. So, I think we need to give direction on how much, so do you have any suggestions?
I think we need to look at administration. I think that there's a lot of extra people, staff here in administration that we could look at possibly cutting instead of cutting more from our schools or our teachers. So I would want to start there.
I think the question is what? Is it come back and make sure it's at 6, so you would need to cut the 1 point, where are we at, 7?
We're at 7, what?
7
something.
Just want to inform the board that.
I would like to see, for example, buildings that we're not using, that we're not utilizing.
I think it's the what, not the how.
So the number, what do you wanna see it from 7 to what?
To half of it,
No, not 6.
to 6 at least. We need to be realistic. I mean, it's not gonna be possible that they cut off at 50%. But the ideal would be like this, but at least at 6,
So you want it at 6,
at least.
and what would you like that?
I think
Still high.
I mean, it is still high, but I think that's a good start. I mean,
Do you think we can do something at 6, Dr. Galavis?
Well, let me, I want to
Something
make
that's
sure.
realistic. We're not gonna put too much harm in this, but something realistic.
That's the thing. We would like to say, oh, we needed it free, like we adopted, but that's not possible. That's not possible. That's not possible. So we need to be
At
realistic.
least at 6.
And what time frame does that?
My problem is just, all we're talking about is cutting.
Well, we need to tell them what.
Just a number.
The problem is we have no choice but to bankrupt the district, that's the other choice. I mean, that's a serious situation, and I don't wanna go in detail of some of this stuff, but I think we need to give direction. So the consensus has been 6.
Yes, I think that's good. Yes.
And that's why, again, I wanna reiterate to our board why that bond is so incredibly important. It'll help us, not maybe next year, but down the road, because if you see the projections, we're gonna be bankrupt.
I just want to remind the board and let the board know that we did talk to our council, our attorney, Steve Blanco. Most of your high dollar that you're looking at are have contracts. So, in order to let the high dollar ones with contract go, you're gonna have to, which will be in our next slide, do a reduction in force. Which is a change in program, change in, which we'll be talking about in, with our legal, Mr. Blanco here at the regular board meeting. So, and just to do $1 million, 4 months salary.
It should have been let that drop.
Well, it wasn't, because last year's budget, it was, again, I'm not gonna go back. We'll be waiting on their governor to do something. Since, fall, August, September, in the special sessions, everybody kept talking about it. And now, he hasn't done anything, and now we have to take action, and here we are. So we have, again, at the regular board meeting in February, we're gonna bring a reduction in force, policy DFFB, what's in your packet, that's what we're taking forward. And And then with that, we have a solid plan along with this to next year be black again. So, can put $1 million, but again, it's a little high dollar, majority of them are on contracts.
Well,
But why is it all salary? It doesn't have to all come from salaries. I mean, a majority.
The majority is from salaries, it's 84,
85%.
85%.
Well, but to cut $1 million though, doesn't necessarily, I get it that, most of it goes from salaries, but that's the entire budget. But to get down from $1 million, it doesn't have to be all salaries. It will take some salaries, but I think if we take a hard look, there are contracts that we have with vendors that we don't necessarily use to the maximum. Duplication of services, I don't know if you've done all that, and maybe you have. But there's a lot, in school districts, there's a lot of duplication of services where you have high dollar contracts with vendors and they're duplicating services.
So we have the consensus, we'll keep going.
Thank you.
I was tasked with giving you a glimpse of the outlook for school districts. We talking about the legislature and the input of billions of dollars that the state government has. This year alone, there's about a $4 billion surplus that was expected to be funneled down from the state government down to the school districts. And that didn't happen. As you can tell, in the 88th Texas legislature, there were several bills that were introduced by both the House and the Senate. All of those that were not approved and would have funneled down anywhere between $5.2 to $7.6 billion to do anything from salary increases to increase student allotment, and that didn't happen. The only thing that did happen was House Bill 3 that increased safety and security by 28 cents per student, and as you can tell, that's not going to be enough. Wanted just to give you a glimpse of what's going on. You saw in the previous slide the impact that it's having throughout the state. It's not just a problem for Canutillo, it's a problem for school districts everywhere, including in Austin, Houston, Dallas. This is an issue that's going to impact all of us, including school districts here in Region 19.
Dr. Rico, I've seen that slide that you have in regards to student enrollment and staffing. Can you find that?
Student enrollment and staffing, yes, it's going to be on the next few ones. I don't know if these are the ones that you're making reference to. This particular one talks about our enrollment trends, right?
No, I'm talking about the one where you have the line graph and see that in the presentation.
It is not on this presentation, board president.
I'll let you, I didn't know you were next, so I'll let you go with your presentation and then go from there.
Yeah, and then just to inform the board, so there is data consumption that we have as a district that shows enrollment and corresponds it with staffing. So we know that we cannot continue to staff our district at the numbers when we had 6,300 students. We're now at 5,900. So we do understand that reality. We will put it on a Thursday packet so that you're able to see that as well. But one of the things that you're seeing on this next slide is the reality that we've been communicating to you and to the bond committee, that we are having a mass exodus of our students. Roofs keep coming up, tax base keeps going up, but when the tax is collected and we look at our enrollment, what we get back from the state does not match what is being taken in those property taxes, because we're losing students. And I know we've gone back and forth with the committee to bring different solutions to the board regarding construction. And whatever the reason, because we've heard it might be programs, it might be proximity, whatever the reason is, we're losing students, right? And the result is the same. The state is not going to partially fund it if it was because of traffic problems that they're creating with the expansion of roads. They're not going to increase the hit we take because it's programs they don't like from our district. The bottom line is, as you can see every year, we are anticipating now, we started with 140, we're anticipating now about 160 to 180 students that we will lose on the basis of two things. Number one, it's transfers out of the district. So transfers out of the district are those we can identify that at one point were, district students and they're no longer there. Our biggest worry is that that's not our biggest transfer out. we do get a data package from the state that we've been requesting over the past 4 years. And that data package shows us number of students that transfer out of our district and where they go, and they break it down by school district and by grade level. We've asked several times the adjoining districts and at the committee's request as to can we identify those students so that we can identify the reasons why they left. Now, the districts know that we're going to be trying to bring them back, right? So obviously that has not been there, but we do now see a dire situation in the sense that our biggest issues in transfers happen at the elementary school. So we have a lot of students in our community that never start in our school district. I talked to you about 10th and 11th grade being the highest enrolled when it comes to district numbers. 2nd and 3rd grade are the lowest enrolled, right? So that is worrisome to us because as we graduate those 10th and 11th graders sitting in school right now, I can with certainty tell you that it's about half that we're replacing in the coming cohort. So if you can see here, this is what we were looking at even prior to that $2.5 million that you saw this year. So we were a little more conservative with the enrollment loss that we're having. But if you look at this particular graph, it shows you that we will be under 5,000 rather soon in the next 6 years. And this has precipitated now, as we were able to see in the budgetary numbers. So the enrollment keeps declining, right? So when we talk about the hard choices that are made, yes, we are talking about people that we employ. We're talking about positions. We're talking about programs. We're talking about everything because we have essentially gone from 6,300 students a couple of years ago to what we are now forecasting around 26-27 school year to be under 5,000. So a loss of 1,300 students is devastating to the revenue that the district has. When you look at how devastating I wish the next graph was showing you that this is the enrollment that we're gaining back. This is the number of dollars that we are going to be bringing to you as a loss every year, right? So what we are anticipating the loss of revenue at current trends, and like you heard tonight, the current trend that we were expecting was nowhere near what we thought was going to happen. So these are numbers based on projections, like a lot of things that we bring you, right? It's us looking at current trends, it's us looking at past behavior and telling you, well, this is what we think. But if you look at these numbers, the number that we've been presenting to the committee is that when you look at 28-29 school year, it'll be $27 million out of that budget due to the loss of enrollment. Now, one of the things that we've been educated ourselves and in the committee is there's a lot of roofs coming up, right? We talked yesterday in a very different venue about the number of acres to be developed by one developer only. By one developer, we're looking at 163 acres in the next 8 years. We're looking at, when Mr. Reyes has presented to the committee, 5,000 roofs that are coming on right now, right? So your question to us is going to be, well, what about those property taxes? Property taxes or percentage will go to you as a board for your budget, but the majority of it will be attached to that student enrollment. So it doesn't matter if we increase by 20,000 roofs, if we cannot bring students to our schools, the impact on our budget from those taxes is going to be minute. So if you look at what we're projecting, and now we would have to reproject and see if that's still the reality with the trend that we saw this year. In 5 years, as our board president was indicating with the statement that we could go bankrupt, it would be a very feasible reality if we do not make difficult choices now.
That's why we need those schools in those communities where they're building hundreds of houses.
That's the long term.
Yeah. Well, yeah, but I get it, but we're talking long term here. We're talking 7 years. By then there'll be, if the bond passes, we'll have those schools already built.
Correct. And when the bond passes, that's a decision that we're going to start looking as to being strategic with Gustavo, being strategic with whoever is hired as a bond manager to communicate to these neighborhoods, hey, we're open for business, and you can bring your kids here. And we are a AAA rated district. We are your best option in town. Our schools are safe. Our teachers are great. We need to communicate that to them so that they feel comfortable and confident in sending their kids to us for whatever the reason. I know we've gone back and forth with committees as to what is the reason. At the end of the day, the reason that we're talking about today is just the dollars that we're losing because kids are not here. So yes, the strategic plan, when that bond passes, is to bring them back, is to remove that payment of the tax notes, is to, now that I also see facilities, is to remove those one-time fixes, right? Hopefully those playgrounds are part of that maintenance that we can do, those roofs, those HVAC systems.
The other issue is the one that, I mean, we've talked about a marketing plan, we've heard it in the community meetings, and we still need to develop a marketing plan to actually attract those students.
Correct. And that's something that we will be tasked with, because again, the loss of students is real, it's tangible, and it's hurting the decisions that you can make that impact people's lives.
I've heard for 3 board meetings at least where Mr. Rodriguez has said, we need a campaign, we need something, but we've not seen anything. So I say that I want something presented at our next board meeting, that's in 2 weeks, a start of what is it that we're doing to get our district out there. What are we doing? What are we doing, or do we have even if we make calls on the phone and say, hey, why aren't you in our district, or whatever it is, I don't care what the plan is, there's gotta be a plan. He's asked for a plan. I mean, we talk about the marketing plan, but we've never seen one, and time is running out.
Yes.
It's frustrating, it really is, the marketing. We've got to do something with the marketing.
That's correct. We do have plans for a marketing plan, but we also need a budget for the marketing plan. That's something that we don't have.
And that's something I think that administration needs to look at and figure out how you're gonna get that, but I would like to see the marketing plan and find a way how we're gonna roll it out, because I think it's essential.
Right, correct. And we'll bring that to you.
On this next slide, members of the board, you're able to see the reality that we're looking at today, right? So the blue is the revenue, the money coming in, the orange is the money going out. You see 19, 20, 21, where that blue overpowers that orange, but then you start seeing in 22, 23, 24, 25, and 26 that the expenses are surpassing the revenue. What that means is continue to be staff at schools that are replaced the same way as when we had 6,300 students. We continue to run programs the same way, right? Anticipating that those students were going to return. However, the reality has translated into something different. So when we talked to you about the numbers that Ms. Foley was bringing up earlier, that green line shows the effect on the funds balance, and it shows a non-operational facility, right? If we continue to take from the savings to pay the electric bill, to pay salaries, it will not be sustainable. You can kind of think about it in your own finances, right? If you have money saved away, but every month you decide to spend more, at a given point, your savings are gonna run out, right? And when that happens, the reality is different. So that's what we're showing here. And this last slide, this is replicated from the bond committee meetings. So 27 was what we were anticipating by 2028. I can no longer with certainty tell you that it would be less than or at 27 million, simply because of the realities that we see today with current legislation of homestead exemptions, with current enrollment numbers. This number may be precipitated one way or the other. Either it's going to be larger by 2028 or it's going to reach that number before 2028. So that's what I agree with your assessment, that we need to find ways to attract students, and I applaud your efforts for successfully working with the bond committee that met yesterday to really have a master plan for our district, which we need to continue to think about, not just in this bond and what we want to do to increase enrollment with those new schools, but really you're also going to be tasked with looking at those properties, those 163 acres, looking at everything that is being developed around us, because this is going to get out of hand quickly with growth. So your leadership will be of utmost importance as we move forward when this bond is passed and when we start forecasting for the future as well.
Any questions in regards to what I would like to see that slide, if you could, whoever's coming next, I think that would give me some time. Huh? Is that the alligator slide? Yeah.
I actually do have some questions, and I, trying to prepare for this meeting, I pulled out everything. But one of the things that I pulled out was our annual comprehensive financial report. And I know, looking at this bar graph you were just discussing, Dr. Rico, of our revenues basically staying about the same, but our expenditures going up. I noticed that across the board, it's in this packet, but it's basically the last 10 years going over the different things that we spend, and I was seeing huge increases from basically 2018 through 2023 in our instructional budget every year. So like from 2018 to 2019, we went up $4 million. Then from 2020 to 2021, we went up $6 million. From, let's see, 2002 to 2003, it was another 3.5, give or take. So I'm just wondering, yes, from 2022 to 2023. So in the midst of basically 5 years, we increased what we were spending on instruction by $10 million. Can we figure out why those amounts went up so much?
For the most part, that's related to salaries. Of course, our biggest group is instructional. We also had several years where we made where we purchased like the laptops. Those were purchased in fiscal year 2021, I believe.
So those would have been under the instruction category,
Correct.
even though they were purchased with maintenance tax.
Yes, they're part of that
That's
money was
still-
infused
okay.
into the general fund.
And that would have been in 2020?
We purchased them
Fiscal
in
year.
fiscal year 21. Yeah, because we purchased them in June of 2020.
And partially as well, Ms. Barnes, sorry. There was a House bill somewhere in between 2019 and 2021 that required school districts to do full day pre-K, right? So what that meant was now districts had to provide pre-K services to students the entire day. We were anticipating that with that, when you asked me to hire a full teacher, that full funding would come. The mandate occurred, but the funding remains at half, right? So the district then needed to make up the difference. So you start seeing those changes in that money because that House Bill 3 required school districts to provide that service, similar to with the police officers, right? So we're required or recommended to have certain services.
Exactly.
We were anticipating, okay, let's do this because the funding would come with it. There was a lot of unfunded measures that they came with in those years.
Okay. And then I guess the other category that I kind of saw some of those trends in was the facilities acquisition and construction. Certain years we would have $20 million, and then other years it was as low as 324. So are those the years that we were building schools from? Because like the one for 20 million was in 2014, and then we brought it all the way down. So is that because we were no longer building new buildings and things of that sort?
So we had an active bond, so we were making capital improvements.
Okay, that makes sense. All right, so I think for me that answers that. If there's anything else in instruction that we did implement that made a huge increase like that, let's look and see, is it faring well in our instruction, I guess, to determine if that okay.
And before you respond, Dr. Courtney, I just want all of us to be mindful that the reason we have school districts is for instruction.
Yeah,
That should be the very last, and you know that as a teacher, former teacher, that should be the very last thing we cut. Now, we should be diligent.
That's what
Yeah,
I saw.
but we're in, the academic piece that's why we're in school, to teach.
Yes,
Well, and
but diligence, I think, is
But I think the alligator slide would help on that, and that's my biggest concern. And what I did ask for was staffing guidelines, so that way we could find out. And I guess is Martha going to be next, or who's going to be? Because I guess my concern here is, we could find the central office organizational chart online, and so it's interesting. And this is my biggest thing, is that the fact that we need to make sure that we take care of the classroom first, the campus second, and figure out what we need to do And that's why I'm concerned with that alligator slide, because we've seen, did you have what?
The alligator slide, just what I do is when a district, you have your enrollment remains constant or declining, hiring,
Oh, I see.
so the alligator will get you,
Oh.
referred to as an alligator.
And I know some of the, part of them were COVID too, because there was a lot of funding that came in, and we didn't do reduction there, but I guess I'll hand it over to staff or Dr. G.
No, I think, I mean, the time is here, it's time is to pay, you know, we told you, don't you agree to 21, if we don't build those schools, lose enrollment, we're gonna lose money, 22, same thing, and now we're here, now we're in this dire strait or a challenge, and this is an example of what can do, again, along with reducing admin, but we're also gonna have to look at staffing formulas. For example, the minimum requirement by law for elementary is a principal, counselor, even a police officer is not required. Assistant principal, office manager, attendance, register, custodian, teachers, six-week teacher, principals. You can share a nurse, share a librarian, share a PE teacher, reduce the music teacher, so all you need is one elective. Look at our custodial teams, get square footage, use all educational aides, parent liaison, instructional coaches, receptionists.
Can I, just really quickly, I don't think instructional coaches belongs there. I will tell you that research shows that the one person on a campus that makes the most impact on instruction at a school, I mean, obviously with the teachers, but they work with the teachers as an instructional coach. So I want to see that as something that.
We could also say that about music. We could also
No, you can. I could show you the research on an instructional coach.
in regards
And you
to,
like being a AAA district, sir.
No, I agree, but this is what we're looking at in regards to what administration is going to provide to us. I know you're in the field, so you understand it a lot better, but the question for us is the what, not the how.
Which is fair. I was just giving my opinion that the instructional coach should be the last
I
that you
think
look
it's a
at.
valid point, because you are 100%.
They influence the teachers and the teaching in the classrooms.
The most.
And I think while the conversation then is after, I would like the presentation first, but to say what is a priority then, and have administration come up with that priority, whatever the research shows, or whatever that may be. That's something that administration needs to provide to us in those ranking orders, depending on how dire the district may get, depending on the balanced budget or the balanced budget with having to address the maintenance issues. So I'll let staff go, and then we could ask questions after.
Okay. So basically, I was tasked with providing, like I said, this is just informational. One of the questions that I was asked is, what is legally necessary to operate a campus? And of course, what you have highlighted in yellow is what we found that is legally required. Everything else is not. However, there's a lot of local decision that comes into play. And at the same time, of course, as Chief Human Resource Officer, some of the things that you see here, this is for discussion. It's not necessarily something that, from the HR perspective, I would recommend, because as we've talked, you know, we all understand that 85% of our budget is personnel. And so, of course, in order to recap or recover some of the deficit, it's going to impact personnel. So what we're looking at here is just, you know, what is legally required, what is required by program. We highlighted that in green. You know, what's in blue is positions that are not legally required, but the elimination of that should be really like last resort, because it will hinder operations.
So of course, we need to take all that into consideration. What you see first here is the elementary. We have a similar one for the middle school.
Ms. Carrasco,
Yes,
hang on one second. You have police officer highlighted as required by law. From what I understand, districts can now do a waiver.
that's correct.
That is correct,
That's
okay, I just
correct.
wanted to make sure.
And so right now, we're compliant with what the law requires a police officer for each campus. That was something that I think was discussed with the board previously, and that was the direction that we decided to go into. So right now, we're holding that. But of course, yes, we can ask for waivers and do away with police officers. But that's not the direction we went into. So this is where we are now. So we highlighted it as a requirement.
Ms. Carrasco.
Yes, ma'am.
Is this for all levels, for all campuses, for example, is the same thing? It's only elementary,
This is
right?
elementary.
Do we have for middle schools and
The next page,
Okay, thank you.
the next slide will give you the middle school. Again, principal, counselor, police officer, teachers. Again, what's in green required by programs. You know, like we have special ed programs, and of course those are driven by what's decided at the ARDs, the staffing. I mean, that's different. Again, what we have highlighted in blue, not legally required, but again, last resort as reduction in staff there because, you know, again, we don't want to hinder our operations. So we did list here, you know, possible FTE reductions or possible FTE sharing and reductions. You know, we can split, for example, a librarian, you know, those type of things that they can share. So those are things that, you know, we need to talk about and look at. But all the possibilities that we could think of are being spelled out on these slides. High school staffing, for example, also the same thing. You know, what's required. You know, we have, for example, here, it's nurse, LVN. You know, years back, we talked about having just LVNs in our schools. That's a possibility. But of course, in years past, you know, there was a push for us to have RNs, which is what we have staffing at our campuses currently. RNs, yes. So we have registered nurses versus the licensed vocational nurse. I believe we have one currently that works at the high school, and I think according to Dr. Reyes, can go back and forth and help with some of the absences of nurses and things like that, can fill in as a sub also. So as you can see, these are positions that we've outlined, that we've looked at, you know, that we just want to throw everything out there. What can we do? For central office, one of the things that we looked at for central office personnel, I know that one of the ideas was that let's go ahead, and I'm going to take off central office and just say personnel overall. I did reach out to TASB to see, I know they do staffing reviews. We want to make sure that the approach that we take is, you know, evaluation by leveraging their external expertise and identifying potential efficiencies, providing their best practice. We want to make sure that some of those things, Dr. Galvez and I believe Finance has recommended that we find an outside person to come in and do an evaluation of our staff, and of course it would be district-wide, not only with central office. And that is something that we're looking at to do also.
And what are the costs associated with them coming in and doing that?
I believe the TASB one is for the consultation is $12,400 plus travel expenses.
Can I?
Get a break because of the president?
I know, right?
Yeah.
Can I share something with you, on the TASB study? I would really like you to, research, and somewhere else that I know of. We just did it for the first time ever, and it was more work on your department than it was, what they provided. Cause you have to go in there and fix everything. It's not apples to apples. So I'm living through that right now. I don't know that the expense is worth it. I think we're so small that you can do it internally and do a better job, Martha.
Yes, and we've started doing that internally, but of course, we want to be, my HR department really wants to, not be accused of having an internal bias. And so that is something that
But you still can with the CISD study.
and so that's something that
Yeah.
was brought up. And so absolutely, what we've done on our side so far with we've done a lot of research in our department. I mean, we've gone back and looked at historical data of how many, compared to our staffing in years back. I mean, we've got a lot of material on staffing. We've compared ourselves to other districts our size. We've reached out, to ask about, how are they staffed. So we've done, I feel comfortable that we've done enough research and we have backup to some of the recommendations that we're making. I just wanted to appease some of the ideas about there being an internal bias. And so by doing that, bringing in an external person, someone asked, okay, can we find out who is out there that does that? Of course, there's TASB. I believe Ms. Pikarski has found another individual that does staffing, or that is there, and I believe that I guess when I saw the price on that, it's pricey. And so either, like you said, we're more than happy to do it ourselves and continue the route we're doing based on some of the recommendations that were coming forth.
Now, Martha, excuse me, I'm sorry, my apologies. And in order for what you're saying is probably valid, but you're not going to be the one making the decision. It's going to be the superintendent with the collaboration of his cabinet to say, and every cabinet member is going to be in there and they're going to be able to say why their position is important for their position. But that's really the job of the superintendent to do that. You're going to give them suggestions, every department, and then Ms. Reyes is going to say, wait, on this cut, and everybody has a say. And I'm just giving an example. But ultimately, him as the superintendent, he makes that decision. The bias is not yours. He makes the decision for our school district.
That's correct. And like I said, in having conversations with staff, of course, everybody's going to want to say,
of course,
not this one, it's my office. And so,
to pick the ones that are it's going to be.
These are going to be crucial conversations, and they're going to be decisions that have to be made, just like we made them here recently. However, this budget shortfall, of course, is going to require additional steps for us to take. And I know that in talking with Dr. Galaviz and talking to our legal counsel, we've been looking at policy, and I know that we've been talking about reduction in force based on our local policy DFFB. And basically what that means is that there's going to be a program change, which is an elimination, curtailment, or reorganization of a program, department, school operation, or curriculum offering, including a change in curriculum objectives, a modification of master schedule. And one of the things that we decided is, or that we talked about, and Dr. Rico can expand on that, is that we're changing our block schedules for our secondary campuses to traditional schedule, except for Northwest Early College. But we're making some changes there, and that in itself is going to free up some FTEs that we're going to be able to bring forth on that. So I know Dr. Rico, I don't know if you want to talk a little bit more about that scheduling.
Yes, so members of the board, just to clarify for those of you that haven't worked in schools, right, or have kids in high school. So there's two different types of scheduling that we can do. A block schedule requires usually it's a 4x4, so 4 classes per day, 90 minutes. Now, traditionally, every teacher has a 90-minute period off, right, so that they can prepare for it. Yeah. So the next day, same thing. So teachers in 2 days will get 2 90-minute block periods off. Additionally, there's classes that are double blocked. I don't know off the top of my head, but athletics, certain areas of mathematics, certain things that you can say, okay, this teacher will now have one set of kids both days for that 90-minute block. The documentation from TEA, although it's dated, it's back from 2014, I want to say, says that operational expenses, not including FTEs, is about $300,000 for a comprehensive high school to operate. And then FTEs, they anticipate that a high school our size, it takes about an additional 8 full-time employees to make that schedule work. At a middle school, similar to the size of our middle schools, about 4 teachers to make that work. Both our middle schools and our high schools run a block scheduling concept. So we don't want the quality of the education to change. We researched that what would happen moving from one to the other. According to the TEA documentation and CASB's documentation is a few things. The mathematics attainment and the science attainment actually increases when it comes going daily. The only thing that they do caution is now kids have more transition, so we need to target parties and we need to target idle bodies now, right?
I was about to say, be careful what you're about to say, because I'm very familiar with this. Actually, it's proven that a traditional schedule is better, especially for the math and the sciences. Absolutely, that they go to that class every single day. As a matter of fact, in a block schedule, it's kind of become antiquated in the sense that it requires a lot of training for that teacher, because research shows that the teacher doesn't keep the kids engaged for 90 minutes. It's a blow-off 45 minutes.
Yeah.
So that's my 2 cents on that. Right there. And it costs a lot less to do a traditional schedule, and it's better for kids.
And just for reference, we don't know exactly because we're still working on our end to figure that out. The move from traditional at the high school, which was last year's at 2018, the move from traditional to block required 12 full-time employees in order for that to work. According to anecdotal evidence from the assistant principal doing it now, because we did ask for that. We don't have historical data to show you, but it takes about 12 teachers for that high school to be on a 4x4, simply because now, instead of giving the mandated 450 minutes of preparation time for teachers, which an elementary teacher is very used to, the secondaries are getting twice that time.
And I want to share with my colleagues that aren't familiar with this, that is very important too, that when we do block scheduling, it's every other day that they go to that class. So if they're absent one day, they've missed almost half a week of instruction. So that's detrimental to their learning. I think we should do that just because it's great for kids, and then it's going to save us tons of money.
Well, actually, we're again, working on this, and we're projecting that it's going to save us like 16 FTEs on the teaching side on that. So by making those changes, like Dr. Rico said, we're working on the scheduling. That's something that we've got scheduled for next week to sit down and look and look at the areas that we may need to have that reduction come forth.
And the recurring cost on that, I know you hear FTEs, but we're talking dollars tonight, right? So it's about $1.2 million a year that move would save a recurring cost.
The other thing that we talked about was modification or reorganization of our staffing patterns in a department or in a campus or district-wide. That is also something that we looked at, collapsing some of the duties, some of the departments, and we're doing that already. We're also looking at a possible at the end of the month or at the next board meeting to bring forth to the Board of Trustees the approval of pausing Deanna Davenport, and that is something that we are looking at also. So those are decisions that require board approval, and we will be bringing those forth to you. If you look at the next slide, reduction in force, again, it says that it can affect any of these areas, the elementary grades, the levels, the subject, departments, programs, secondary grades, special programs, counseling programs, library programs, nursing and other health services programs, an educational support program that does not provide direct instruction to students, other district-wide programs, and it says an individual campus. And of course, this is where, you know, we're looking at, the pausing of DDE. Administrative positions, a unit, a department, and other contractual positions. And that's something that, again, we will bring you the plan at the next regular board meeting, for board approval, so that we can go ahead and capture, some of those dollar amounts that we need to bring the budget back in line.
So one of the things that they tasked was $1 million, right? That we only wanted the deficit to be to $6 million. Or how much ever it was, yes. Just by going from block schedule to a regular schedule, you're already gonna make 1.7 million, is that what you said?
1.2.
1.2.
1,140,000 in those changes. And another thing that we have on here is sizing it. When we say sizing, you're familiar with this one too, there's certain things that teachers are certified to teach, but we currently run a lot of loads under 15, under 12 kids. So what we want to do is collapse those classes, right size them, and then maximize our teachers, right? I'm certified to teach life sciences, physical sciences, things like that, right? So you could use somebody like me to teach chemistry, to teach biology, to teach physics. So we want to do that with everybody through and make sure that what is being invested in kids, it's being invested right.
Well, and so you're proving my point where you said, oh, it's too much, we want to be realistic. There's things that we could look at where it could be less than 6 million as our deficit, because just by changing the block schedule right there is 1.2 million.
Correct. And by right sizing it, so we think it would be closer to $2 million.
One of the things, I mean, I always say, show me your budget and we'll see where your priorities are. And looking at this budget, I mean, let's be honest. We have a HR director and we have a superintendent, and your cabinet needs to get together and look at those numbers. You're looking at student enrollment and staffing. Is that correct?
Correct. So what you see on this graph in front of you, members of the board, is two lines. Your orange line is your student enrollment. Your blue line on this particular slide is everybody who is campus-based. So we defined it on the previous slide. But, so do you understand? Everybody who clocks in a campus, right? So instructional based. Here is the growth in blue in positions from the base year. The base year is 2011. So in 2011, for example, we had 793 full-time employees in the district, and we had 5,938 students. So from 2011, you see the orange line, that's student enrollment. The blue line that you see is FTEs. So the alligator that we're talking about is as enrollment drops. For example, if you take a look at 2015, enrollment drops, but the corresponding blue line does not drop at the same rate. So this is what we are talking about, and you're going to see it precipitated in 2020 all the way to 2024 in staff.
I have a question for you. Elementary classrooms, are they 22-to-1?
That is the base, yes. And in some instances, it goes to 24.
Okay, good. So we do take advantage of the waiver, and it can go.
Yes, and
okay.
we do take a look at that, but in some instances.
That's some savings too.
Yes, but in some instances, because it needs to be bilingual, or, you know, so it also depends on the certifications that.
Do we do transitional classes at all, where we put the majority, I can't remember the percentages bilingual, but you could put some monolingual kids in that class?
Yes, we do.
Okay.
And going back to what I wanted to say was the fact that we've increased our staff and we've had a decline in enrollment, and these are critical times, and believe me, it's tough because we don't want to let people go, especially people in our community, but these are tough decisions that have to be made, and Dr. Galaviz, as we're only able to look at you as our superintendent and either hold you accountable or set direction for you. We've talked about the direction of the 6 million, the consensus of it, but we're looking at some serious decisions that have to be made, and we have to go back to those levels where we had the enrollment we currently have and what that staff look like. And so those are stuff that could happen internally, and you all have the ability to. And as you've done it previously with the 13 positions, I would hope that we give a lot more ample time to those employees, because it's sad that it has to happen, but we need to be a better proactive than waiting until it's towards the end and it hits families hard. So I think we need to be very proactive on this, and what I would like to see is, you know, I think the staffing, the TASB staffing is an excuse. I think what we need to figure out and ask your all staff, your all's departments, look at where we were at and ask how can we be better with less, right? We know that the legislators' inaction has caused this, the declining enrollment has caused this, inflationary costs that continue to go up has caused this, the insurance costs that continue to go up have caused this, and we have no other choice but to make sure we right size, like we've been talking about the facilities, right size and making sure we right place, or what's the
Right sizing.
Yeah, right sizing. We're gonna have to, I think this is a time to lead, a sad time, but it has to happen, and I'm hoping that at the next budget presentation, we would get a better understanding of, especially this page, because as we know, we do not want to affect the classroom. Classroom is number one. We know that the quality of instruction, and praise to our teachers that have done a tremendous job, and our administrators as well as our superintendent and the rest of central office. We've seen tremendous success in our community. We've seen us the only AAA rated district in the region. We've seen blue ribbon schools within our district. We've seen continuous improvement within our students. But the only choice we have is to lead at this point with the inaction of the legislator. And it's sad, but it's gonna have to happen. So is there any other questions from?
I do, I have a couple. Do you know the cost difference, what the savings would be if we went from RNs to LVNs?
I don't have that calculated. I know that, like I said, I know that a few years back,
It's
the district
significant, right?
looked at that option, but we had a lot of pushback and they wanted PRNs, and so we went ahead and kept that.
Who's they?
The community and the campus.
Dash. Who's that?
Okay, so can we look at that though? I mean, we're in dire times right now. I would, you know, like an RN. I mean, there's a lot of things that we would like. I just wanna see it, what the cost difference it might be
The
with
registered
it.
nurse, they could apply medication, they could push medications, the other category cannot do that.
I think
They
an
would have a
LVN
lot of
can.
kids sick over here in the school district, that's why as a parent, I mean,
Oh,
I
okay.
was a parent 504 in certain things, LVNs, the other ones they cannot do, they cannot push certain medications, so you need to be very, very careful about the medications that we administrate to the
And I
kids.
appreciate that, so I would like you to bring us some information, cause I don't have the same information as, Mrs. Chow, and if what she's saying, I would like to know that. So educate us, in the sense, the difference between LVN and RN and then the money. And then my next question is the police department. What is the budget for the entire police department?
I don't have that. Christie, do you have
And we can do it for the next budget workshop, I'm sure we're gonna be doing a lot of this. I would like to know what it costs us, and the operating.
I can have that for you in the Thursday packet for next week.
Okay, that'd be good, just to have an idea of what it's costing. And then some information on, because, we don't have to go extreme, but like having an armed security guard, because security guards can be armed, some of them. I think so. I think there's a lot, one per campus. I think security guard. Can you look into that? I'm almost sure.
No, police officer, armed officers, one per campus, according to the law.
Well, it's changed now though, you can apply for a waiver, the law has changed.
So that's correct, we can apply for the waiver. Currently, we have not, so that's why we haven't gotten to, we're given that option now because we haven't applied for or gotten approved for the waiver. But that's something that we can explore and we can give information.
And I'm not saying I wanna go that route, I just wanna be educated in, what it costs, and then is there another way to have, cause I think security for our kids is very important, but at the same time, is there another way, and I'm almost sure, I don't know if it's a security guard, but they could be armed, I'm almost sure.
It can be a level 3 security guard.
Okay, that's what I
What
thought.
we had discussed in the safety and security meetings was that they don't have the training that, or the hours of training that a TCO certified police officer would have. So in a moment of emergency, the reaction and the training.
They're gonna be like everybody else, like all of us, run!
It's a totally different training.
We don't want that.
It's a different.
Yeah. So just give us some information, I think, that's important, like what it costs, and then give us some, to know that, level 3 security guard, they don't have the training, and then
this is
also
the cost
the
of the
LVN and RN, so that when I'm asked, I can say, oh, I can answer like Blanca Trout, an RN can give the medicine and an LVN can't, and so that we could justify to our community as well, so I would like that on our next budget, meeting as well.
To give you a price tag, an average estimate without benefit included, if the LVN earns about, on an average point, about 36,000, where a registered nurse starts at 60.
Okay. So if you get that in our our Thursday packet, I apologize, yeah.
So I know we had discussion earlier about central office, and I appreciate your Armando bringing that up, that we need to look at that slide. I agree that I don't think CISD is the right way to go there. I think that we have more than enough capable people to be able to figure out what we need to do. But quite frankly, I think that the central office slide should look like this. We should be able to come up with the same type of what's required, what's our breakdown, what are we overflow on, where can we cut. That's basically what I was, what you wrote down here for the elementary, middle school, and high school, I think we should be looking at for the central office as well.
And I agree with that with Ms. Barnes, and I think that what Mr. Rodriguez said is very powerful, where each one of you as leaders on cabinet, you look and you say, okay, if I have to give up something, this is what I'm gonna give up, and you give your suggestions, and dig deep, I mean, and then.
That is correct, it's not just about giving up, it's about trying to transform your department in a way that's gonna better serve the campus, and at the end, better serve, when it better serves the campus, it's gonna be able to have the impact that it needs to have on our kids. So I think there's areas where, I understand we grew, we had, you know, we had, federal money during COVID, and we had ESSER, and we had all, you know, but it's not here anymore, and the legislator has not helped us any bit of it, and we have no other choice. It's sad times, but it's stuff that I think your all departments, Dr. Galaviz, have to lead in this area. Is there, you know, is there innovative software that cost cut? Is there innovative, is there positions that we could collapse that, you know, we were comfortable because we didn't have to make these calls. So we've known each department has grown, right, Martha?
That's correct. We have started to collapse some positions, and I know that when we had the ESSER money, you know, it was just hiring. We had hiring left and right. One of the things I cautioned everybody is that we're going to get comfortable with the extra help.
Correct.
And then everybody's is going to want to keep the help that they had. So of course, when the ESSER money went away, some of the positions were absorbed into the departments. So at that point in time, I mean, yes, we are looking at that. We're working on that and working hand in hand with Dr. Rico and Dr. Kearney so that we can work on this and then, of course, share the information or the recommendations with Dr. Galavis.
And I think, what I would like you to share with the cabinet and, Dr. Galavis, because I know that we love our people and we see them, there are people that we work with in departments, but it's so important that at your level is to look at it, it's not personal. Look at it that way, it's personnel. It's not personal, it's personnel. It's about running a school district so it's effective, like Mr. Rodriguez said, and innovative and in a way that we're going to serve kids.
And just if I may add to what Ms. Carrasco also said, on this graph, you can take 2020 as the base year. You see a sharp increase in 21, 22, 23. So those were a lot of ESER positions. For example, y'all remember we had a COVID manager. That's no longer there. Y'all remember we had tech for every campus. So if you look at 2020, that's probably your best base year. That's what we need to correct because that didn't have that influx of self money from COVID relief.
And if I may, this is just an idea, something to consider. I know that we're going to have to be looking at, and this would mostly be for next year, but it's something that I guess start considering. Central office is going to be moving regardless, so talking about budgets for next year, a lot of us got used to working remotely and doing things remotely during COVID, and I think we learned that there were a lot of positions that could be done without a brick and mortar building. We talk about being innovative and, you know, setting that example for what we can do to change different ideas. Do we need all of central office here at all times? You know, can we?
That's a great comment, Ms. Barnes.
Physical presence?
Steve Barnes, because we wanted to do that. However, the board at the time said, kids are in seats, you're in your seat.
Yeah, because I think a lot of things come into play with that, Ms. Barnes, and we have to be really careful because then they see, oh, she's the chief or assistant superintendent, she gets to be at home.
Well, and one thing to consider is even if we don't go remotely, we have a lot of extra space at some of our campuses that could be utilized. So, you know, we're talking about closing, the possibility of closing Davenport, but we could really look at that same possibility here. Closing down this building and dispersing people throughout into the community at the campuses. Now, I think it would be a great idea just in general because then people will know your faces. Then people know who you are. You're there. They know who their superintendent is. They know who HR is. Just some ideas to think about because if we're going to be talking about closing down the possibility of pausing, closing, whatever term we're going to use for it now, we could look at that same possibility for this building. And I think that's something that we should consider as well for cost saving measures.
Anybody else? No? I think we, I do have one question and I didn't want to.
Dead horse already.
Well, I did have a question on golden pennies. Do we have capacity, and if so, and we could probably look at that in the next, but do we have capacity and how many pennies?
We are maxed on our golden pennies. Currently we have 8 cents, which is the max.
So we
did have.
If you want to come to the mic, just to explain, golden pennies are pretty much what we've been in the past, which we would go to the tax rate.
So we are funded in different tiers. Golden pennies, we have currently 8 cents, which is where we receive our maximum funding. That is the maximum amount that we can have. We do have copper pennies, and my understanding is that we do have some capacity in the copper pennies. We did have our financial advisor provide us a scenario, and I think I want to say it would generate about $500,000. I don't know if you remember that, Dr. Galavis, for Martha. Something like that. It was about 500,000, I believe.
And that would have to go to the taxpayer, though, right?
Correct. It would require.
If you could just add a slide to that, and I think we're going to go back to the slides where you have the ADA, the enrollment. I think we also need to look at the areas district deficits of previous year, current, because we're not the only ones facing this problem. I know that several colleagues across the city, especially because of our time and our press that we're getting, that were leading in this discussion, that they're making tough decisions, and they thanked us because it's tough times that we're in. So on the next slide, if we could do that, but I appreciate that. I think that's just a conversational piece on that, and I just wanted to add that in case, and I think Dr. Galvis wanted to say something.
Before we close out, board, I just wanted your sentiment regarding LCD, FFD, reduction in force. Some of what we want, not some of, most of what we want to do is going to require that. We'd like to bring that in February. And so we plan to go to Davenport on Monday, February 12th at 3 o'clock to talk to staff, and at 6 o'clock to bring the community to tell them our recommendation. Just wanted to.
And what I've said in the past, Dr. Galvis, is this should be the last resort. My area of concern is there's areas that need to be looked at, like central office, before we have an impact in the classroom and the campus. So I would hope that we address some of that in the next presentation, because I'm extremely concerned of closing a campus, but and I want to see what your recommendations are. So going back to that, I thank my colleagues and I thank staff. I know over the last couple of weeks it's been kind of frustrating as we had conversation, but it's tough times, it's sad times to let people go in our community. I haven't put faces, and I've heard of some of those faces, and it's sad. But we have no other choice, and we have to make sure we do what's right for our district and for those who have elected us, to make sure that we're good stewards of the taxpayers' money. And so as we continue these tough conversations, it's going to be even tougher when we get closer to adopting a budget, and we have to be able to communicate this to the community as well, and be able to work together in this process. It's going to be a teamwork effort for us to come out of this trimmer better, and hopefully not have an impact in the classroom, because that's what we're here for, is to see each and every day those wonderful kids that we serve. So, thank you.
Item number 2B, healthcare update, the Senator by this month for
Board members, I've invited Randy McGraw to come up if you all have any questions. I did provide you the revenue and expense report from the finance department for December 31st, 2023. Basically, that one, if you look at the current year, it says that we are in a negative 880,424. That is where we are. I know that I always say that Randy's projections are only as good as the finance provides us the information. However, I know that Ms. Pekarsky has told me it is a circular calculation, simply because based on the projections, the paperwork, the numbers that finance provides us, he provides his projections, and then of course in turn, his projections assist finance to also do their numbers for our healthcare plan. We have here also a summary on the second page of our health plan, and it's a summary that is the current enrollment results. As you all know, we had open enrollment, which was going to take effect on January 1. And going back and forth, we had, we had multiple discussions and plans and things that we discussed. And having said that, I know that we did have, and I'll go into it a little bit later, but we did have some changes in our enrollments in our health plan. So far, it says district contributions, remember at $623 per employee per month. District contributions, based on that, is $5,539,716. And then payroll deduction contributions, this is based on how the employees selected which health plan and how much they have to pay. It's $2,053,200. Total revenues that we collect with those two is $7,592,916. Projected expenses. We have an administrative expense, which is prescription drug rebate. It's a credit of $220,121. We have reinsurance expense, $1,633,495. And claims expense, we have $6,140,738, which is a total expenses of $7,554,112. So we have the fund balance as of 12/31/23. It is a negative $880,424. Projected fund balance for December 31st, 2024 is a negative $837,088.86. And so that's where we are as far as a summary. I know that Randy has taken that information and has done his projections. We have our enrollment has declined in our health plan by 7%. So contributions therefore declined by 6%. And so this forecast is based upon 2023 lost data only. Remember, we're doing this based on December 2023. And I'll go ahead, Randy, do you want to explain still? We still need January, February, March, and so to get a clearer picture of where we're at.
Sure. It's been a long meeting. I know it's challenging for you. So we did change the benefits effective January 1. And with the timing of how healthcare claims get submitted, there's a lag time before we'll see those claims starting to be paid by the district. In fact, because of the timing of open enrollment and the transmission of eligibility data to Blue Cross and Blue Shield, who broke a lot of rules, their internal rules to accommodate us, so we appreciate them for doing that. So the main goal for them was to get identification cards out to everybody as quickly as possible. And they couldn't get them to you by January the 1st, and they started arriving about in the first week of January, I believe. So they got those out, but it takes longer for them to recode their system to process claims under the new benefit structure. So what they did was they put a hold on any claims that were going to be incurred after January the 1st to not process them until their system is built. So the claims that rolled into the month of January, and I don't know what those are, we'll get a report next week around the 15th. But the claims that rolled in the first weeks of January were only claims incurred in 2023. And so they won't unlock the 2024 claims until, well, actually about the last week of January. So it should have suppressed the cash flow for you some in January. And then we'll start to see a full pipeline of data coming from January claims data on, which will reflect the changes in the benefits. And we won't know for sure what risks stayed on your plan. So you did have about, like Martha said, you had about 7% decline in enrollment. That was around 50 people
that dropped out of the plan. That caused your outflow of your 623 per employee to drop. So that's helping out some too. And then the claims that are going to get paid in January and February and the first part of March are primarily claims from 2023. So we won't know who stayed, meaning which risk stayed. So it's possible, I guess there's two schools of thought if we're just going to guess, is that people were concerned about the plan design changes because we didn't change payroll deductions. There was no increase to employees on payroll deduction. And there was no increase from the district in your contribution. The only thing that changed were benefits. But the benefit changes included raising deductibles substantially, raising out-of-pocket maximums, office visit co-pays, urgent care co-pays, pretty much anything could change on January the 1st. So it could be that when people were making their enrollment decisions, they're deciding like, what's my benefit versus what am I going to pay? Do I want to keep my dependents here, myself here, or maybe they have an avenue for other coverage. So some of your employees that dropped coverage probably migrated to another plan somewhere. So if those were high utilizing members, and they wanted to chase a lower copay or deductible, some of your high risk may have migrated out of the plan. We won't know that for a couple more months until we see the claims data coming in. So the projections are based on averages in terms of what the benefit change should impact and should generate. And I was working to be conservative, so hopefully the outcome, hopefully high risk migrated out of the plan, and hopefully the average estimate is wrong and your performance comes in better than expected. So you ended up the year actually better than we thought you would. Your claims were on a trend going up, and as you got into December, they declined some and stayed stable. And you had a decline somewhat in your prescription drug utilization too. So hopefully those things will continue, and the changes in your enrollment and the benefit elections, changes in the risk, drive that down. Yeah, but the main objective here with the plan design changes was to at least stop, by the end of the year, there being a negative cash flow. So in the first quarter of this year, it's probably still going to be a negative cash flow as we run out the 2023 claims. And then as we move into April and beyond, it should be offsetting that, and you should gain ground and end up the year at least in the same ballpark where you started, if not better. And it's all going to be a function of which risk stayed in the plan.
And as Ms. Pooley had talked to you about, that we do need an increase in funding that's needed is $1.8 million. So that's what is included in her budget projections.
I couldn't hear. Funding is needed. How much?
1,836,397.
What that number does is it repays you your general fund back to $880,000, and then the rest of it is to establish that reserve that we've talked about all night long, a lot of different things.
So that's basically the update of where we are currently. And again, that all this will fluctuate as we go into the next few months.
Any other questions?
I just want to ask you a little bit about the negative cash flow that you were talking about. Can you please help me to understand?
I'm sorry, what was it?
The negative cash flow that you were just talking right now.
Okay, so we've been experiencing that negative cash flow for quite some time. And just because we crossed the line to January 1st doesn't mean those claims that have already been incurred are going to go away. They're going to manifest themselves for payment in January, February, and March. But and then the reduced claims due to changes in the benefits should start to show up with enough credible data by the end of April.
So that's when we're going to have the results to see.
That's when we'll have a better picture. So the one thing we'll know right away is if it's really bad, that's easy to figure out. you'll see the expenses are way higher. If they start to look good, then that's promising, but we're not gonna know that they're really good until we get to about April.
Yeah.
And January is gonna be a little bit depressed because there was a hold on the claims incurred in 2024. A lot of those claims are being subjected to a deductible, so that there is maybe no expense to the district. But doctor office visits, prescription drugs, those claims will come through pretty quickly.
Thank you.
Thank you.
Thank you, board.
Item number 3, meeting adjournment. Time is 8:25 p.m.
Without objection, meeting adjourned.
Thank you.